Hello, I'm Dr. Beth Goldstein. Over the next 5 minutes, I'm going to be sharing best practices performing punch biopsies on the skin. First of all, you want to make sure this is the correct process for obtaining information to get a good diagnosis. You're looking for pathology in the deeper dermis or in the subcutaneous layers. And it may also, you're choosing a punch because areas that you might normally shave would leave an unsightly scar. So you can use a punch biopsy not only to get the information you need, but also for better aesthetics when necessary. So first of all, you want to think about what are the structures underneath? Are there any superficial arteries? Are there any nerves that you need to be cautious of? And then you want to determine your depth based on what is underneath there. And then I'll often stretch the skin to see which way is going to be the best way to orient my punch so that my closure will go along facial tension lines. For preps, you want to use either isopropyl alcohol or iodine around the eye because hemocleanse is both oculotoxic and also for the ears, ototoxic. So you want to either use iodine or rubbing alcohol here. When performing the punch biopsy, of course, you're going to be using lidocaine. I typically use lidocaine 1% with epinephrine 1 to 100,000. And with the depth here, I'm going until I can feel a little give and I'm in the superficial subcutaneous area here. You want to have forceps and gradle scissors to help gently lift the tissue out. You want to be careful not to crush the tissue because that can impede a good reading by your pathologist, and to make sure that your bottle is nearby and already open. Often we will not stitch 3 millimeter punch biopsies. There have been studies that show it does not improve the aesthetic outcome, but in many patients are often on blood thinners. And so you'll put in a suture. And here you can see I'm also reorienting to make sure I go along skin tension lines. And this will help with hemostasis. And I'm using a 5-0 chromic because it's dissolvable and the patient won't need to come back for a suture removal here. And aesthetically, it does very well. For most of my patients, I will perform a single suture. Sometimes you'll need a second. For wound care at this moment, we'll use either a silver gel, Aquaphor, or Vaseline, and a pressure dressing. And that can consist of a 2x2 with tape, a cotton ball under a Band-Aid, but something to give that extra pressure. For wound care as patient leaves, we allow them to get the area wet within 24 hours and then apply either Vaseline or Aquaphor and keep it covered for 5 to 7 days. They are instructed to call if there's any increasing pain and instructed to apply firm pressure for 15 minutes if there's any bleeding afterwards.